Good afternoon. I'd like to call the Emergency Policy Group meeting to order. Hope everyone had a good weekend and doing well. Well, the weekend, the day is Thursday. What are we talking about? Days are running together here. Sorry about that. The clerk, please call the roll.
Good afternoon. Miller?
Here.
Overman?
Here.
Merman?
Here.
Lott? Mayor Lott? Castic? Mayor Castic?
Here. I'm here.
Ross?
Here.
Frosting?
Yes, sir, I'm here.
Snively?
Here.
Mr. Merrill?
Yes, I'm here.
Thank you. You have a forum.
Thank you very much. We're going to move into public comment. We've allotted 20 minutes total for public comment, each speaker having 2 minutes apiece. We have 3 people that have signed up. The first person is Galen Ridzik.
Yes. Okay. Okay, yeah. Good afternoon. I'm calling because I saw a local op-ed that said that the board would not pass a measure that would protect against individuals from being fired or kicked out of businesses for wearing a face mask. My understanding is that the board did not pass this measure because they feared that they were overstepping their bounds and that this would violate property rights. But from what I've seen from the community, in the past 3 days, I've garnered a signature or a petition with over 150 signatures that said that this is not acceptable and that the rights to individual protections outweigh the rights of businesses. And we would like to see this measure put forth. Thank you.
Okay, thank you very much, sir. Elizabeth Kelly Tredelang.
Elizabeth did not call in, sir.
She didn't call, okay. Chris Ann Hall.
Our Declaration of Independence establishes the purpose of every government is to secure the rights of the people, and that includes Hillsborough County and this EPG. Inherent in that duty is to provide the people with full disclosure of information regarding the basis for any rule, law, or regulation that infringes upon those rights, and this EPG has not been successful in doing that. For example, top immunologists and physicians across the world are releasing data and medical reports, like the one recently published by the World Health Organization and the National Institute of Health, that only healthcare providers should wear masks, and that the general public wearing masks is not only ineffective in controlling the spread of COVID, but is also dangerous as it can complicate other health conditions and can cause reckless behavior created by a false sense of security. These reports from top immunologists also explain that previous released theories that asymptomatic people can unknowingly spread COVID-19 are now proven false by hard data and research. Finally, on April 20th, Dr. Holt told this EPG on the record that a, quote, high probability of false positives from COVID-19 tests were being reported across the globe. As this committee ponders future EPG action, we should remember that a positive test result does not mean a contagious person. And the test itself, according to the information received by this committee, has been found to be inaccurate at best. And its results alone should not be the basis for any future infringement upon the rights of the people and their businesses. The people of Hillsborough County are asking this committee to seek, report, and consider all credible available information before making any further decisions, and not to rely upon the reports and data that is only favorable to one side or one perspective. Thank you.
Thank you. Best of luck to you. That concludes the public comment section of our agenda. Now moving to emergency management update. Mr. Dudley.
Good afternoon.
We continue to support home testing operations at remote collection sites, Raymond James, Lee Davis, South Shore, Plant City, and our new location opened 8 June in Brandon with our partners at Suncoast Community Health Center. It offers evening and Saturday testing. Testing conducted last week as of close of business on the 5th, 3,227. Total tested since the beginning of the operation, a little over 27,000. Thank you so much to the teams out there for doing a great job out there on the sites. Testing conducted this week as a close of business Wednesday, the 10th, 1,956. As a close of business on Friday, we had 3,373 appointments scheduled. By close of business on Wednesday, the 10th, we had 1,239 appointments scheduled for the rest of the week. For folks that's still interested in taking advantage of our testing, you can still contact the call center, 272-5900, from 8 to 5, Monday through Friday. Logistics, we continue to distribute PPE, critical PPE items like glove, masks, face shields, gowns, and goggles to support our ALFs, nursing homes, and any folks in those fields that have critical items. We had a slight increase in masks, just masks for the month of June, slightly. And also for support of our collection sites, yesterday we received 15,000 cloth masks to distribute to our collection sites, and we'll hand out a mask to individuals that that visit our collection site for testing. So we're appreciative of receiving that distribution from the state, and we'll be distributing those to our collection site here for this week and through next week's testing. Currently, we have 4 guests at the quarantine site, and we have 13 guests at the isolation site. And we continue to support the mission for testing for our long-term healthcare facilities. That concludes my updates. Any questions?
Thank you, Mr. Dudley. I don't see any questions at this time, so thank you very much. Appreciate it.
Thank you, sir.
Dr. Holt.
Yes, sir. This is Dr. Holt, the Director of the Florida Department of Health, Hillsborough County. Just a comment to clarify one of the speakers. The comment I made about false positive tests being common were about an antibody test. This is to detect whether you could have been exposed in the past, not actively infected. And those tests have been shown to be falsely positive. That's not the case with our PCR. Just wanted to be clear. The information today, we will cover what's been going on in Hillsborough County with COVID over the past week. You'll see that the cases are going up, but we have not reached the stage where we need to step back as long as we're able to continue to do what we need to do to reduce the spread. We are nearing the crossroads as a community, and by working together, we can continue or at least regain our pre-COVID lives. Following the leadership of Governor DeSantis, we can continue with our smart reopening, combined with this education about how we can stop and reduce the spread, and the ask that is being made by him and the Florida Department of Health to take these steps. I will begin by asking Dean Donna Peterson from USF College of Public Health and Dr. Marissa Levine, the professor and director of the Center for Leadership Public Health Practice at USF College of Public Health, to talk about the importance of all the practical things that we all must do or we can choose to do to protect ourselves and others. They have both spoken to us in the past. I will then provide an overview of the epidemiology report. We'll focus on the past 2 weeks as focused on this 2 weeks and the period since our reopening. I'll make, again, my high-level comments and take-homes and points, and then Mr. Kevin Wagner will show the data, walk us through the PowerPoint. Finally, I'll finish with a request for Dr. Kelly Devers, the Chief Medical Examiner for Hillsborough County. He's also an assistant professor at USF Morsani College of Medicine. She's going to talk about the role of the medical examiner in our COVID-19 response. Will be available for questions after each of the presentations. I'll begin by asking if Dr. Peterson and Dr. Levine are on and would begin.
Thank you, Doug. Chair Miller.
Yes, ma'am.
Good afternoon, members of the Emergency Policy Group. I'm Dean Peterson from the USF College of Public Health. And as it's always a pleasure to be here and address these very interesting times we are in. And I think you've done a wonderful job navigating very rough waters. But I think what we certainly know is that we learn more every day as we experience COVID-19 in our community, and what are the best ways to respond to it, and what are the best ways to regain some level of vibrant community life. As Doug just said, we very much would like to get back to our pre-COVID lives. But until we have a vaccine and we've developed herd immunity, we are going to have to continue to practice the best possible ways of preventing the spread of disease as we can until we get to that point. And we know now that the same preventive measures we've discussed from the very beginning, maintaining a distance, about 6 feet between other people, not coming together in large gatherings, wearing face coverings whenever we're in shared spaces with other people, and maintaining the disinfecting and hand hygiene that prevents the spread from surfaces. If we continue to practice all of those preventive practices, then we can continue to live our lives and get beyond this, get to the point where once a vaccine is developed and we've developed herd immunity, then we know we can live with what remains of COVID-19. And I know Dr. Levine has far more experience than I do, so I would happily turn it over to her.
Thank you, Dean Peterson. Chairman Miller, members of the committee, I apologize for background noise. I'm in transit, but I thought it was really important to be here with you. I really think the community is at a critical turning point, but we have the opportunity to take advantage of preventing a second wave. And I don't have a crystal ball, so I don't pretend to tell you what's going to happen, but we are seeing the numbers going up. And as you'll see, a lot of that increase is in the younger population. I remember being younger and feeling invincible too, but we need them to help protect the more vulnerable. Otherwise, we'll see our hospitalization numbers go up and the deaths increase also. This is a really important time to physical separation and the hand hygiene, but I think that we have, contrary to what you may have heard from some of the public speaking, we have better evidence now that cloth face coverings and as well as all the other masks do make a difference. There have been studies recently that looked at all the evidence we have, and it's clear that if we can get more people to do that regularly and implement that on a day-to-day when they can't maintain their physical separation, then in all likelihood we could prevent the second wave. So I definitely urge you to help get that message out. And I think it's a really important time to do it now, because if we wait too long, it could be too late in terms of the increase in cases. And I'll stop there.
Okay. Any questions of either of the doctors? Let me ask a question here. It is quite apparent that the numbers that we have, not only in Hillsborough County, but across the state and in other areas, that the numbers of those that are probably between the ages of I'm going to say 18 to 35. Those are the ones that's increasing. Am I correct?
Yes, Commissioner Miller. We will go into quite a bit of detail in the coming presentation, but
Okay.
you are correct.
Okay. All right. Well, I'll wait till then because, you know, the two doctors are basically saying that it is very apparent that the face mask and the social distancing is a thing we have to adhere to at this point, because the mere fact is that if we don't, we're going to be back in the same predicament we were in before. You're going to see more positive tests, more hospitals, and more deaths. So, but I'll wait till we get to the other presentation. Dr. Levine, Dr. Peterson, is there anything else you need to bring before us now?
I'm happy to answer any questions, but no, not at this point.
Okay, I don't see any questions. So thank you both for your presentation. I know you all have to run to, I think, to another meeting. So thank you very much.
Thank you, Mr. Chair.
Yes, ma'am. Dr. Holt.
Yes, sir. And just a comment before we get into the epidemiology. You know, I continue to support the Florida Department of Health and Governor DeSantis and the basis behind the mask. I know that's face coverings. It's gotten a lot of attention, but anyone, if we understand that if you are infected, you will begin to shed the virus about 2 to 3 days after that, and you won't know that you're infected. And the amount of virus you shed will increase and persist for over the next 20 days, whether you're symptomatic or not. So there is a period that if we could tell we were infected, you know, you definitely should wear the mask. But unfortunately with this virus, we don't know that. So that's the basis of the advice, and the studies are clear that that virus is expelled during that 20-day period. I'll stop there and move on into the epidemiology.
Dr. Holt, before you do that, Mayor Castor has a question. Mayor Castor, you recognize.
Thank you, Chair. And just I raised my hand when Mr. Dudley was speaking, but I think Dr. Holt could answer it as well. I'd like to know, since we've started the testing at the CVS's, and I believe, I'm not sure if Publix has jumped on, but anticipated that they will, if those testing data is being factored in. And then also, I think for Mr. Dudley, I was informed that we were going to 5 days a week at Raymond James Stadium. So is that, or the state was supposed to provide the collection kits and the personnel for that? So just an update possibly if you have it. Thanks, Chair.
This is Dr. Holt. I could address the first question. We are beginning to see, as Mayor Castor noted, more testing available, and I think that was anticipated. I think I'm very, very thankful for that, for CVS and other retailers that are going to step up. I have reached out to just determine the type of tests they're using, and so I will hopefully be able to provide some more information. But every test that is done is required to be reported to the state of Florida. So we will be aware of results, positive and negative, for any test done, no matter where it's done in this county. What I can't provide, but CVS possibly could, or anybody in that situation, would be their own data about how many tests they performed and how many of them are positive or negative, which under Gene Early's leadership, we have received from our hospital partners. I hope that answers your question, Mayor.
Yes, thank you. I think, Chair, this brings back up to the surface our need to encourage, do another round of marketing the encouragement for people to go out and get tested, because we're we're ramping up opportunity, but from the data that I see, there are less individuals signing up at the different sites. So just a suggestion that maybe we could look at from the marketing and communication. Thank you.
Okay, I don't see any more hands, so Holt, you want to proceed?
Yes, sir. As of this morning, we have reported 3,181 cases in Hillsborough County. That's an increase of 704 from the last time I reported, or an average of 100 a day. Our long-term care facilities, while cumulative of 539 cases associated with them, and we did see an increase of 81 over the past week, but 59 or almost 75% of those came in the last 40 hours associated with some mass testing that was done sometimes even up to a week or so back. We're going to start with some of the same data that we've talked about each week, but then I will talk or add some additional data that was both requested by the members and I think was important for us to understand what's going on with COVID in our community. The first one, we'll look at some demographics. We'll look at our age since the reopening. Of note is the percentage of the cases that are under the age of 34 has increased from 21% in the 2 weeks period that was ended in 5/13, essentially the first week of our reopening, to 46% in the most recent. These increases percentage-wise are highest in the youngest, going upwards from 0 to 5, 5 to 14, and up to, or 15 to 24, and then up to 25 to 34. But the greatest number, absolute numbers, and now the highest percentage of age that represents of all of our cases in the most recent 2 weeks are in those that are 25 to 34 age range. Our age of 35 to 44 has really not changed. It's remained about 10%. And again, I think notably, cases in 45 and over previously had combined had totaled 40% of our cases. Now is at 28%. The largest decrease is in those cases, in the population positive cases of those over the age of 65. We also will present some data regarding look at our cases by racial categories. And again, our most recent 2 weeks that ended 6/3 compared to those that ended back in April of 20, there has been an increase in the number of cases reported that report being black. But I would note that during this period, we did expand the community-based testing sites to target those places and neighborhoods for people with color. And if you look since the reopening, it really hasn't changed as a percentage of the total cases. We also looked at the ethnicity in 14-day points of time. Again, we don't see any changes in the 2 weeks from the time of ending 4/20. But I would observe the same thing is that we have seen some increase since the 2 week period, May 4th, which was just prior to the reopening. But again, we increased the access to testing. Next week, we're working to present data that will look at our zip codes of our cases. There is already a lot of good data available, including the City of Tampa website, USF. Our focus is going to be on those zip codes for the cases in the most recent 7 to 14 days, looking for the largest number of increase or percentage increase. This real time should help us know precisely, or at least generally, where COVID has been recently and is now, so we can target our testing and education. The 14-day trajectory of our cases, similar to a pattern that's seen statewide and in other counties, there has been an increasing trend over the past 14 days that has been sustained. The number of tests we're doing still, while trending up, is not quite as steep of an increase. We have now tested 5.5% of our population. The 14-day positivity rate, overall trend is decreasing. We did have a few days of where it did decrease, but overall that is continuing to increase. And as I mentioned previously, we want to see both this percentage go down, even though, again, it's relatively low and under 5%, but still we'd like to see it going down. This all suggests we are beginning to see some more community-based spread. This is an observation that has been supported by our private medical community, who told me about increased numbers of demand in their drive-thrus and some associated positivity in those sites and our emergency room. They describe most of these patients as being symptomatic, with the vast majority having known exposure, household, family, friends, and workers. The deaths overall have remained unchanged. This reflects really, I think, again, while the increases number of cases we've seen, they're mostly in our younger population, and Dr. Devers will talk a little bit more about that. Looking at our hospitals, the overall is good news. They're pretty steady at a 70% occupancy rate of their beds. We have 142 patients that were hospitalized as of June 8th, as the report will show. I would note that this changes. If you look at it, you'll see over the past week, it started with 134, dropped down to 118, and then has jumped up. This is all associated with the matter of how many were admitted and how many are discharged. And we did have some recent long-term care facility transfers that, again, as I mentioned, are associated with mass testing. If you look at the number and the percentage of ICU beds of our population, remains quite low, and our ventilators are very low. And my medical colleagues tell me that they really work. Their medical practice is to avoid ventilators, and they found better ways to treat the patients. Finally, we are going to conclude with a high-level comparison of other counties, looking at cases per 100,000. I think you'll note that we are similar to Pinellas and Duval. Manatee does have a little higher. Concern for all of us is the increasing trajectory, especially with our neighbors in Pinellas. And I would emphasize that COVID follows people. So it's really a regional issue that we're addressing. I will stop there.
Okay. Dr. Holt, I don't see any questions at this time. So you may continue. I guess the next person is going to be Kevin Wagner. Mr. Wagner?
Yes.
Mr. Chairman, can you see my presentation, sir?
Yes, sir.
Thank you again. Thank you for letting me speak to the EPG members here today. My name is Kevin Wagner, the business analyst for the Healthcare Services Department of Hillsborough County. And again, I will be presenting the data that is accompanying Dr. Holt's verbal presentation from a holistic viewpoint. As indicated, we do have 3,174 total cases as the 10 a.m. update for the FDOH. This is consistent from a gender standpoint, where 53% are women and 47% are men. And as indicated, we've tested over 5% of the total population, again, with the June 11th update. The age breakdown, we have seen this the past month as presented. This previously was a normal bell curve. As indicated through the presentation, we are now seeing an increase in the 25 to 34 age range and the 15 to 24, and even under the 15-year-old age range. As you can see, this is no longer a static bell curve, but it is tipping on the forward side of the younger population who is more mobile. Currently, the ages of 65 and plus make up about 20% of the positive cases. Nearly 75% of the positive cases are in the middle bracket of 15 to 64, i.e. the working force, and the remaining 5% are under 14 years of age, and this is an aggregate of the cases. Speaking about the increase in positivity on the 14-day projection, this is quite an important slide, and when we look at this, speaking on the far left-hand column under the age of 14, on May 13th, there was a 14-day average of 2% was under 14 years of age in positivity. We roll forward to May 27th, those 14 days, that increased to 5%. We roll forward another 14 days to June 10th. The positivity of the 14-day in that age group is 8%. So now we can see that that's climbed up almost fourfold from May 13th to June 10th. We roll over to the next column, the 15 to 24. Again, you have the increase from May to June from 4.5% to nearly 15%. Now we're getting into the older working force. The age of 25 to 34, we've seen a quite large jump from 14% in May, around May 13th, to nearly 23% in June 10th. So those three categories from 0 to 34 have trended upward in positive averages for the last 14 days. As indicated by Dr. Holt, the middle group of 35 to 64 has been consistent or flat in the positivity rates. Again, we still want to see that the trend downward, but that is flattening. And the large other group of the age 65 and over, that has been the opposite. That has trended downward from May, around 40% of the 14-day positivity rate, to down to 14.5% in June. So we see the trend of the older individuals of 65 plus testing positive less. The younger individuals of 0 to 34 are testing positive more. So that is a trend that we need to talk about today. With regard to the race, as indicated by Dr. Holt, not a lot of variance between the Caucasians and African Americans. Again, on a 14-day count based upon the data is reported. Again, anywhere for the African American population, it's around 26%. The Caucasian or white is around 33% in June. But as you see, there's a high unknown. Again, as the data gets reported and gets calculated in, that number generally shifts down. So again, the race stays essentially the same from a positivity standpoint. The ethnicity after the race, again, has been consistent, where the non-Hispanic is around 50% as a general whole. The Hispanic on the population on June 3rd was around 31%. On May 18th, 28% as identified as Hispanic. Again, we have to remember that's when most of the reopening occurred after May 4th. So again, the race is essentially the same and the ethnicity is the same. The ages are trending to the younger population. When we look at the overall cases on an individual day and a rolling 14-day average, the columns in yellow are the previous 14 days, where you can visually see probably 6 of the last 8 days have been at 100 or above, with today being the highest as reported by FDOH on 6/11. The rolling 14-day average is about 82 cases per day on the rolling 14-day average. So again, since the increase of the reopening on May 4th, the cases have trended upward along with the state as well as other counties. The testing results, again, this is not as much variability that we've used to see, that we are getting anywhere from 1,400 to 1,700 test results a day, not tests completed, but test results getting reported. So again, our cases are going up. The test results are again flat or consistent around 1,400 to 1,700 a day, trying to get to that 2,250 projected need for population testing as indicated by USF. But this is trending upward, and again, it is not as variable as what it is around 1,400 to 1,700 tests a day. When we talk about casing, we talk about tests, we talk about positivity rates. So the light green bars are the last 14 days of positivity rate from the individual days that we get. So as you can visually see, they have been nearly 6% on some days, exceeding 6% on positivity rates on individual days. So the rolling 14-day average of positivity results is around 4.8%. Still a slight trend downward as the overall aggregate, but the 14 days are trending upward as we can see. As Dr. Holt indicated, the deaths have been consistent, not a larger variability in the number of deaths on 14-day counts, which is a good thing. But again, it's something to watch forward as the virus transmits into society. Hospitalization, as requested by the EPG members, I will speak to the top left-hand chart and guide you through each one. The top left-hand is the total number of hospital beds on a given day. Generally, we are getting this information every 2 to 3 days. On average, there's 4,400 beds available in the system. 30% of them are available unused beds. 1,000 to 1,300 any given day are available from a hospital standpoint. The top right-hand chart is the number of individuals who are using beds and a comparison of how many are COVID and non-COVID. So what does that mean? On June 8th, there was 3,076 beds used. Of those, 142, or a little under 5%, were COVID beds. The remaining 2,900 were for other areas of use, such as elective surgeries. So again, on any given day, the bed utilization in the hospitals is about 5% or under, around 4 to 5%. Speaking on the bottom left-hand chart, this is the number of ICU beds, again, with the COVID usage, other usage, and generally available. On any given day of the ICU beds, the COVID patients make up about 10% of the total utilization of the ICU beds. While there is still available ICU beds, as we see on June 8th, was 113, on June 5th, 66. So again, there is still slack in capacity of the ICU beds, with the COVID making up generally 30 at any given day. With regard to vent utilization, the COVID usage is quite little. On June 8th, there was 11 of nearly 740 vents in the system being used by COVID-admitted patients in the ICU. So again, the vent utilization on COVID is quite low as well currently, which is good information and good news. Regarding the cases per 100,000, this is the comparison, and I like to point out that these lines will always increase upward. This is an aggregate count. This is not an individual. This is an aggregate sum. So again, Hillsborough County is the orange line, essentially in the middle, where our cases per 100,000 are nearly 200 cases per 100,000, which is in the middle. Manatee is slightly higher, as you can see in the yellow, and Pasco is slightly lower. But from a comparison standpoint, these increases are increasing at the region, at the state level, and obviously we know at the local level. And that is all I have. I'll stop there.
Thank you, Mr. Wagner. I see a couple of hands here. Mayor Ross, you recognize.
Thank you, Chair. This question for Mr. Wagner, but Dr. Holt, feel free to jump in also. The rise in cases for children under the age of 14, I guess that makes kind of some sense to me, because we're seeing the younger adults line, that line is rising also, which would be probably the average age of their parents. With the children under 14, it seems like they might be a little easier to do contact tracing with them, if nothing else, because the raw numbers are smaller. And my question is, have we been able to discern a pattern of where they're getting infected? Is it at home from their parents coming home from work? Is it at daycares? Is it at the summer programs that have opened? Like, with that raw number being so small that we might be able to see some pattern. Have we been able to determine anything like that?
Yeah, it's probably a question for me. This is Dr. Holt. The children, the younger than 14, are predominantly in the household with the family. Many of them are actually tested because one of the parents or someone in the family was positive, and they go along, if you will. Although the emergency rooms do report some testing, and that they pick that up because they're testing everyone, so every child that comes in. As for the contact tracing of children, right now it is easier in the sense that they're not in school, they're limited. Their parents are pretty clear in most cases of who they've been around. I will note that in a case under the age of 18, we talk to the parents and the guardian for the information. We have been looking, and we have noted just across the board that while the majority of the cases that, again, and I mentioned last time, probably about 40% of the people will say they know pretty much who and probably where they got it. That's, as the emergency rooms are reporting, are mostly household, family, but we have seen some increases in some workplaces, both large and small. I will emphasize that does not mean that's where they were actually infected. It's just they knew someone else, or that we think that. And I'd also like to note some of these businesses have been extremely responsible and have short-term closed, cleaned, and notified other coworkers. We have asked begin to ask them if they are around any other places regularly with gatherings, whether it's social, religious, or some others, but we've not identified any clusters. We're also beginning to ask if regarding general practices on our social distancing. About 50% of our cases report they do that all the time, especially those in household. And that's not surprising, even though they're getting infected, they have prolonged exposures being in the house and have the closest person-to-person contact. And then the other 50 are there sometimes, or about 25% only if required. So I'll stop there and hope I answered your question.
Okay, thank you, Doctor.
Commissioner Overman, did I see your hand?
Yes, but the question was asked. Thank you very much.
Okay, thank you. Okay, Mr. Wagner, that's all the questions I see at this point. Thank you very much for your presentation. Dr. Holt.
Yes, sir. I'd like to introduce or ask Dr. Kelly Devers. She's our chief medical examiner for the county. She's also an assistant professor at the Morsani College of Medicine. Talk a little bit about her role in this. We work actually quite close together. Talk about some of the understandings of death certificates and her observations. So, Dr. Devers, are you available?
Yes, can you all hear me?
Yes, ma'am.
Hello, thank you so much for asking me to join the meeting today. I appreciate it. I just want to share some information with you regarding how the medical examiner's office is involved in the coronavirus response. Initially, back in March, we developed a letter that was sent out to as many facilities as possible with the help of the Hillsborough County Emergency Management folks and Mr. Dudley. And we tried to cover all of the hospitals, all of the ALFs, all of the funeral homes, emergency medical services, law enforcement, MacDill Air Force Base, Tampa International, everybody that we could think of that needed this information. We tried to disseminate that to everyone as possible, and we've repeated that as needed throughout these past few months. So when someone dies by a disease that constitutes a threat to public health, it becomes a medical examiner. It becomes our jurisdiction under Chapter 40611 as a medical examiner case, which means that we are responsible for generating the cause and manner of death for the death certificate for the person who passed away from coronavirus. So we have several scenarios that we have applied to this. The first scenario is if a person passes away, say in a hospital, and they have been confirmed coronavirus positive, those cases will not require transport to the medical examiner's office. Those deceased persons can be transported to the funeral home of the family's choice, and we will review the medical records and then determine cause and manner of death. In the second scenario, the swabs have been taken and the person passes away either in the hospital or at home. We will determine jurisdiction upon receipt of the test results. And we ask that the hospitals, nursing homes, and funeral homes be aware of that, report these deaths to us. And we have had that happen on several occasions where we've been notified by family members or funeral homes, so that we will take jurisdiction of the case and request the medical records. In the third scenario, people are found passed away at home. They may not have family. There may be no history as to how they were feeling before they passed away. Those persons are going to come to our office anyway and have at least an external examination, and then we will swab that person and submit the test samples to the Department of Health and wait for those test results. So those are the three different scenarios that we have applied to this situation. As far as what we have seen so far at our office, we are obliged to report all the deaths in Hillsborough County, whether they are residents of the county or not, to the Medical Examiner Commission and through the FDLE. We have been doing that since the end of March, since we saw our first death. I wanted to share some of that data with you. And of course, also we're sharing that information with the Department of Health as well, with Dr. Holt and his group of epidemiologists. So far, as of today, we have 92 reported deaths. And there was one more that I believe came while I was preparing for the meeting. The demographics and the age ranges, we have 38 men, which is 41% of the cases, 54 women, which comprise 59% of the cases. There are, of those, African Americans comprise 23% or 21 deceased, and then 71 white or other nationalities, 77%. The average age of the persons who have passed away is 78. Our age range has been 35 to 100 years old. The persons under 60 has been about 5 people, and the 35-year-old person who passed away had other medical issues, and then the others that are under 60 are in their late 50s. As far as persons dying at home or being transferred from home to the hospital or hospice, we've had 35 deaths. That's 38% of our cases. At the assisted living facilities and nursing homes, those have comprised 62% of our cases, or 57 persons passed away. All of the people who have died in Hillsborough County have had at least one, but mostly multiple comorbidities, including most commonly heart disease, coronary artery disease, hypertension, atrial fibrillation, 85% of cases. Diabetes mellitus, 47% of cases. Dementia, 34%. Chronic obstructive pulmonary disease, 26%. End-stage renal disease, 20%. Immunocompromised for other reasons, 17%. Obstructive sleep apnea, 6%.
Hey, Debbie, hold on, Rob, because I've got the EPG meeting on my phone. Yeah.
Excuse me, I need to put their phone on mute.
Is it okay to go ahead?
Yes, go ahead.
Stroke, 8%, and obesity class 2 or 3, which means a body mass index of greater than 35 to 40, 10%, but that likely is higher because we don't always get the body mass index in the medical records. We try to keep track of that as well. So as far as trending goes, we have seen in the first 26 deaths that were reported to our office, they were either home deaths related to catching the virus from someone they were in contact with, or travel-related deaths where they traveled to places like New York. We've had several cases like that here. After the 26 deaths, the deaths were all coming from nursing homes or assisted living facilities. Up until today, where we had our first death of an elderly lady who was at home and apparently contracted the disease from someone she came in contact with. So that's the first time since the first couple weeks that we have seen that here. And so every time we have a death that occurs in the home, we make sure to let Dr. Holt know, or his epidemiologist know, that this has happened so they can begin contact tracing as soon as possible. Let's see. I think about anything else I could let you know. Do you have any questions for me?
Dr. Deaver, let me see. No, ma'am, I don't see any questions at this time.
Thank you very much.
Okay, thank you. Dr. Holt?
Yes, sir. That concludes the public health portion of the agenda.
Okay, thank you, sir. I'm now going to call on Ms. Liana Lopez. I think you have with you Dr. Eric Eisenberg.
Yes, thank you, Chair. I think that I'm going to lead this. Liana's having some internet connectivity. Liana, are you there somehow, somewhere? That's okay.
I am here. It's just intermittent, but you go ahead and I'll jump in as needed.
Fantastic. Well, thank you,
Dr. Eisenberg. Hold on a minute. Commissioner Merman, did you have a question?
Yes, of Dr. Holt. I could have waited too at the end though, but I just want to ask him the quick question I ask every week. What's the trigger? What actual statistic will you look at to see if when there needs to be further action by the CPG?
Yes, ma'am. I know every week I get your question. There is no exact trigger. If you had to pick a 100%, this is the trigger, would be the hospitals being overwhelmed, which we're not going to allow. I think in the middle, in the between, it's really there is no absolute trigger. The governor and his leadership, local leadership, are all combining, I think, to assess the information locally and get through this period. Vaccines is the final way out, but we're a long way out for that. So I'll stop there.
Thank you.
Okay, Dr. Eisenberg, proceed.
So let me give you an update on communication. So Liana and I have been and her team have been working very hard to provide sustained communication throughout the crisis. And just so you know, there are 3 principles that we've been following in our work. The first one is that this is not a one-shot deal. When you have a dynamic situation like this, you need constant back and forth communication. And so we continue to sort of adapt and revise and refresh our messaging as we learn more. So that's number 1. Number 2 is we want to be as fact-based as possible. One of the good things about these EPG meetings is that we keep trying to return to whatever facts we have. My feeling is that the public is absolutely hungry for facts and very hungry to separate fact from fiction. And we're going to do the best we can. Scientists live in the world of probabilities and stochastic reasoning, but people want to know, can I do it or can't I do it? So we try to really stick to the facts. And then finally, and this really, I think, is relevant today, successful communication has to be adapted to a target audience. And so the kinds of ways you reach and the kinds of arguments and messaging you do to the 25 or 34-year-olds, where we're seeing the case percentages go up, is going to be very, very different from the older population. And so we've been thinking a lot about that. The county has been working with the JIC, the Joint Communication Group, to develop a new, refreshed public messaging strategy related to these facts and these recommendations. And I believe all of your cities and groups are involved in that. And again, this speaks to the issue of that you can't have a single communication strategy when you have a dynamic situation. We are also working with Pinellas County to develop a regional approach and a regional social media campaign, recognizing that people move back and forth between the counties. And what we want to do is we want to use local opinion leaders to sort of get the word out. We're trying to work with all of the pro sports franchises to get messages out. And really all the messaging, as Dean Peterson was saying earlier, really revolves around the issue of how do you deal with close spaces and how do you deal with crowds. If you know you're going to be in close spaces, if you know you're not going to be able to be 6 feet from someone, how can you either enforce social distancing or how can you wear a face covering so that you don't transmit the disease if you are carrying the virus. And so that's good news that we're working on a regional approach. The other thing that I've mentioned to you before is we introduced a survey that we shared with you a couple of weeks ago. I'm pleased to tell you that so far we have 17,000 responses. We're both gratified and a little bit overwhelmed by the responses. And when the survey closes, we're going to get you the information on what's in there. One of the things that we're finding is that the issues that you guys are talking about are exactly the issues that people are bringing up in the survey. They want to know about, as the community reopens, how are we going to handle social distancing and how are we going to handle face coverings and things like that. And one of the things that we're going to do next is we're going to do a zip code analysis, which I promised you a couple of weeks ago, and see how the differences across the county look in terms of attitudes and behaviors around a reopening. So that's where we stand. Leanna, do you want to add to any of that?
No, Eric, I think you described it nicely. The zip code data will be very instrumental in how we move forward from a communication standpoint, especially when it comes to if those behaviors are different, what type of targeted data-driven messages do we have to communicate to those different areas. So it's going to be critical for us as we move forward. And then I'm available for questions if there are any questions.
Okay. Commissioner Merman, you have a question?
Oh, no, sorry. Got to put my hand down.
Okay. Commissioner Overman, you recognize.
Thank you, Chair. And thank you, actually, Kevin Wagner, for the data that he provided us earlier. And thank you, Ms. Lopez and Dr. Eisenberg for working on this. I have two questions. One, what is our target date for announcing and showing us the actual survey results? I've been able to go back into my survey to kind of look at what I'm seeing because it's real time, which is handy. But part of that communication is to help people modify their behavior, since what they're looking for is, what do I do to reduce my risk? If we're not really releasing the data or the survey results, people are still guessing. And I think it's important for us to set a date and then recognize that you're going to continually modify and review that data. But when are we going to get data that we can go on to actually make decisions on what our best recommendations are to our citizens? Because now that we've seen children exposures quadruple, and we've gone from a rolling 14-day average of on May 21st at slightly more than 2% to almost 5%. Clearly, the number of percent positives have increased significantly, and we haven't really shared what people think about that and what they could do and what our recommendations are. So can you help me with that? Because that would be really, really helpful. Thank you.
Yes. So we extended the survey by about a week. It was officially supposed to close yesterday, but we extended it to next Wednesday because we're trying to up participation by the business community. So we're working on some strategies for that. But I don't want you to think that messaging is waiting for the closure of the survey. So we have been monitoring the data in real time consistently. And as we can make tweaks or promote certain things, we are doing that. So I want to be clear about that. That's partly where we got with the face covering discussion we started with our partners this week, and we want to launch that. It'll probably launch before, parts of it will launch before the actual survey closes. And so we'll be able to see kind of some of that real-time change, but we're happy if you need us to provide you a report via email, we can do that. But the survey will officially close next Wednesday, and then we'll be able to give you some of that data pretty quickly. There will be some other components. We're planning a business virtual town hall if we don't up the participation by the business community. So we're going to do a town hall with invited members of the business community working through our ECC and our economic development arm to garner more of that feedback, just to make sure that, the more data we have, the better our decisions will be.
I thank you so very much for that. And so if you had to summarize what your primary recommendations in our communications plan has been for the last 2 weeks, what 3 to 4 things have you emphasized during that time period that may or may not have made a difference in our numbers?
So right now we've been pushing face masks. We started that last week with the EPG meeting and the information that was coming back from the survey, because that has been primarily, whether you look at it from a business perspective, an employee perspective, or just a resident perspective, most residents say of those nearly 17,000 that they will continue to practice that. They do have concerns returning to work and not being mandated from their employer or from them, but 41% of the business members that have taken it, which is low, say they are requiring their employees to wear face coverings. So there's a little bit, but really social distancing, face coverings, kind of the same things we've been talking about. So now we're realizing, okay, if that's still important, how do we refresh the message? And that's what we're working on right now.
Well, right. And refreshing the message is also about figuring out if someone is hearing the message and is not persuaded by it, who would have credibility for them and what would make it persuasive and what other commitments do they have that's making them feel the way they do. So.
Correct. And so we're looking at different spokespeople, different angles, all of that to try and reach everyone as best we can.
Okay. Dr. Devers, did you have a question?
No, I just wanted to mention one more thing I forgot to say earlier is that, everybody that passes away and has a test for COVID does not necessarily get COVID for a diagnosis. We've had about 4 or 5 cases, including one very elderly person who did not display any symptoms and were just screened prior to death. Examples would be overdoses or someone who is not displaying any symptoms that would be convincing to us that they had died from COVID. So I just want to make that a point because, we've had that question arise among parts of the community, different family members, and I just wanted to, thanks.
Okay, thank you. Let me say something here. Specifically with Dr. Eisenberg and Ms. Lopez gathering data, and they talked about the best recommendations is going to have to come from when we have data. We've heard today from Dr. Holt. We've heard today from Dr. Levine and others from the University of South Florida that the best recommendation we could have to prevent the spread of this disease is face coverings, masks. And I do understand that this body does not want to make it mandatory that we wear masks. I understand that. I get it wholeheartedly. But the way that we're going to stop the spread of this disease, and we've heard it from the experts, especially those ages of 25 to 34, who seem to think they're vulnerable. They're not vulnerable. They're Superman. They don't have to wear the disease. Don't have to social distance. The numbers are going to increase. And I know that Dr. Eisenberg and Ms. Lopez are talking about having our regional partners and having that approach, and possibly getting well-known, respected persons in our community and individuals, such as the quarterback, the new quarterback that came in from the Bucks, or a Derek Brooks, or a Lightning player, or a Titus O'Neil, a wrestler that talks about how important it is to wear masks. The body that should make that pitch first is us. We're the EPG, we're the emergency policy group. And I do understand we have our political philosophies that are different from one another. I do understand that. But the bottom line is we should be talking about what can we do to save lives. And we don't want to make it mandatory to wear masks, but we should be the one that's pushing a very, very strong message that please wear your mask. We're not mandating that you wear it, but we're putting a strong message that to curtail this spike that's coming to us, that it's going to be even more spikes next week or the week after, because the mere fact of we just got past the Memorial Day holiday, and we now have all the protests that's going on and people being so close together and they're not wearing masks, or like Dr. Holt said, some people in the household don't know that they have it, or they spread it to someone else, to the youth. We need to be the ones that are sending a strong message. Yeah, we want a Tom Brady. We want a Derek Brooks. We want a Lightning player. We want a Titus O'Neil to be out there saying, do that. And maybe we'll get them to say, wear that mask and how important it is. But as an emergency policy group, the one that people are looking up to, being some of us as elected officials and others that are appointed, we should be sending that message. We're not going to mandate it. We're not going to say mandatory that you wear a mask, but please send a strong message that we ask of you when you're out in the public. And even sometimes if you're sitting at home, wear your mask. I hope I didn't make anyone mad. I hope I didn't, but I just had to say that because these numbers are going up again. They're going up and they're not going to stop unless the people get the message of how important it is to wear your mask, social distance, and all the other things that the CDC said do to keep this from spreading. Hope I didn't make anyone mad, but I had to say that. Dr. Eisenberg and Ms. Lopez, was anything else you need to say? Okay.
No, I don't have anything else to say. Thank you.
Thank you. Ms. Beck.
Good afternoon, Chairman Miller and EPG board members. Christine Beck, County Attorney. As part of your backup, we've provided you another draft order that would extend the state of local emergency for another 7 days as provided for in Florida law. And at this time, it would be appropriate, Mr. Chair, to entertain a motion with regard to the order.
Move approval.
That's a motion by Commissioner Merman, a second by Commissioner Merman. Is there any further discussion? Seeing none, all those in favor, sorry, call the roll.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Lott,
Yes.
Castor,
Yes.
Roth,
Yes.
Cronister,
Yes.
Snively.
Yes.
Motion carries 8-0.
Thank you. Commissioner Merman, I see your hand.
Yes, I just wanted to give a brief comment after you made your comments, because I wholeheartedly agree with you. I think another week has passed and we're embarking on some really critical health and safety issues. And I know you mentioned the star players in the community coming forward. Maybe they could do some public service announcements. But I guess the question for Mr. Merrill or somebody, how can we make our message stronger from the emergency policy group to get it across to people that you have to wear a mask, you have to social distance? I don't think we can wait for this survey to be over. Our hospitalizations could be skyrocketing by then. and then we're going to be faced with an emergency. So I guess that's for Mr. Merrill. How can we strengthen our message? And even Mayor Castor, I don't know, without mandating, what do we do? I mean, it's not a political thing. It really is about health and safety and protecting our residents. So I guess I'm just throwing it out there. How do we strengthen our message? What avenues do we have available to us?
Well, strengthening it is really a byproduct of understanding what Dean Eisenberg had described, and that is that we're a very diverse community, and people come to issues like this with all kinds of beliefs and agendas and concerns. And so to really assume that everyone in the community is going to accept a single message, even if it's from the EPG, is really not reasonable. So what we want to do is to develop messages that appeal to and convince people in the community from their point of view. You have to meet people where they come from, where they are. And if that means that, they're more likely to listen to a message from an opera singer or from a professional football player or from an actor or from a politician, then that message needs to be tailored to that group specifically in order to be effective. And so that is what is being done by the group that Leanna and Dean Eisenberg are leading. It's going to be a message that it has to be continually played out. It has to be adapted as beliefs change. I mean, let's face it, there are going to be some people that we just can't reach. I don't know what percentage of the population that is, but that's just in any situation. Advertisers know that they can't reach 100%, but what they do is they tailor their message to reach as many people as they can, and that's what we're trying to do. I mean, this whole notion of freedom. Let's talk about freedom from disease. I mean, let's talk about the way that our culture got to the point where we don't allow cigarette smoking in buildings anymore because we had evidence that cigarette smoking has a secondary effect and causes cancer. So, we have adapted culturally and passed laws that really protect people who need to be protected from certain behaviors. And as a culture, we've come to agreement on that. That's the thing that's going to happen here. At a certain point, through more effective communication, we will need to move a majority of the population to a point where they believe in their heart that it is everyone's responsibility not only to protect themselves, to protect others from secondary contamination, from secondary infection. That's going to take time, but it's going to have to be strategic to address different segments of the population. That's what we're working on. That's what we're rolling out. And I think that's really the only course of action at this point.
Okay, I hope we don't get to a critical time problem where, this is becoming a crisis again. So awaiting for information. But I hear what you're saying and I agree. And Commissioner Miller, you really hit the nail on the head, really, in just saying that, our numbers are going up. I saw where some communities are mandating tests for people who are participating in protests because they're worried their numbers are going up and the disease is spreading. I mean, there's just so many things going on out there that I don't want to sit on the sidelines. I guess I want to be proactive. So that's all I'll say. Thank you.
Thank you. Commissioner Overman, you recognize.
Thank you very much. And Chair, I really appreciate your comments. I think it gives us an opportunities as leaders to sort of set the dialogue about what citizens can do to allow our progress of reopening our economy and our businesses and allowing our kids to go to childcare and summer programs, and ultimately be able to open our schools this fall, which the governor has released today, a statement regarding a plan for opening schools. But if we're not going to pay attention to the numbers in our own community and encourage the behaviors that our medical professionals have advised us to do, and to continue following whatever the reopening orders that our governor does, then it does become evident that our leadership in making sure that our community is responding to a public health emergency is somewhat challenged. We've offered mixed messages. We say wear face masks, and then we don't actually vote on supporting that effort. Well, I am curious, as well as I respect Commissioner Merman's comments. When we have not gotten an answer from Dr. Holt on what percentage increase is considered a surge that would require us locally to act. We've not got that answer, and it's been asked every single week. And we've seen almost a tripling of the increase of a 14-day surge in positive results as a percentage of the tests that are being taken. And we're not taking action. I do have great concerns about the effectiveness of our leadership. And I know this group is passionate about taking care of our citizens. And I too want to see us take some action at some point in time, and would love to hear from the group what you need to know and what you would need to understand to take action to help our businesses and help our economy continue to open. Because the trend we're seeing, as it does indicate that we're starting to see numbers, albeit lower than other areas of the state. We've done a great job and our citizens have been terrific, but we do see a trend that is troubling. And I'd like to get some feedback from the rest of the group and what you feel is the trigger to help you make a decision to mandate or recommend or put into place changes other than the statewide mandate. And I just put that out there for discussion, please.
Ms. Snively, you recognize.
Thank you, Mr. Chair. I understand the concerns. I appreciate, again, everyone who reported information to us today. And maybe I misheard it, but the answer that Dr. Holt gave us today, which we could explore a little further, is that the trigger would be hospitals being overwhelmed. And if I heard the data correctly today, hospitals are about 5%. So please correct me if I'm not right, but we're at about 5%. So what would the percentage be for hospitals to be considered overwhelmed? And I would say that if that's the recommendation from Dr. Holt to be the trigger to take any further action by this group, then we need to discuss what that looks like. What does it mean for what percentage is considered for hospitals to be overwhelmed? Because that was the original, and I believe that was the original concern, was making sure that our hospitals had the capacity to treat the people who are ill from the coronavirus. So maybe we can explore that. And then towards the end, Chair Miller, I just wanted to make some comments about Governor DeSantis's announcement just earlier today about schools reopening. I can wait until the end if we want to further discuss the trigger we've been talking about. Thank you.
Did you ask a question of Dr. Holt?
Well, it isn't, yes, indirectly. What is that percentage? When is it considered for hospitals to be overwhelmed? At what percent capacity? And did I understand that we're at 5% currently capacity, and what's define overwhelmed?
Dr. Holt?
Yes, sir. And, you know, this is, if you look at that metric, it is one you evolve. So the current occupancy rate is based on what the hospitals, their normal operational. With COVID, as it increases or as they get more and more impacted, they can expand that capacity. So the first thing they would respond to is to increase what currently is the existing number of beds. But you do reach a point where the hospitals basically say, we can't keep opening, we don't have any more to go. And using that number, the 80% rule was what we had originally in the plan before we would begin to look at things like alternate care sites. So that's sort of the trigger. It's not necessarily just what is the percentage of beds that are available at this moment. It's as you progress, and when the hospitals say they have to keep opening or sacrificing or can no longer maintain their normal operations because the COVID is exceeding their ability to continue to expand, then they tell us, you know, basically that is the absolute trigger. And when I say that, it's based on, you know, there's no doubt about that. As Commissioner Overman and some others said, leadership, the numbers and the triggers varies by leadership, and we see that across the country. So there is no science that says this is the absolute number. It is looking at the data and making a judgment. And I follow, you know, and I agree with right now my leadership on the Department of Health. We don't have that at this time, and I wish I could give you an absolute number, but there isn't that. It is each the eye of the beholder, if you will. And I'm sorry that that's just something I cannot tell you when you have to do it, other than what I just said, because there you really have no choice. But we're not there. We're not close to that. But if we keep not proceeding with the current status that we see this rise, that will occur. And I think everybody, all this whole conversation, which is correct, is, you know, people are educate, motivate, and influence their behavior. So anyway, I editorialized a little too much. I'll stop there.
Anything further, Ms. Snively?
I would just, yes, thank you, Chair. I would just say then, it seems to me that we have to lean heavily to a degree on the data that we're continuing to get. If we know it when we see it, it sounds like what Dr. Holt says, we'll know it when we see it, then it's really important for us to just be fluid with this situation. And it may not be a hard number. It may not be 80%, but you know, we certainly want to continue to advocate for healthy habits, and we certainly don't want more people to get ill. But we also know that a lot of our action as an emergency policy group is surrounded by this concept of hospitals and the capacity that hospitals have. And so, in my opinion, we just need to continue listening and getting data from the Department of Health and Dr. Holt, and kind of cross that bridge when we get there if we need to take action, and listen to the advice and the recommendations that come from the Department of Health to help guide us in that, whenever that moment in time occurs. Thank you.
Rick Castor, you recognize.
Thank you, sir. I may just be piling on right here, but I agree with Ms. Snyder. Hospital information is the most accurate because of the number of collections that are taken, and then and then how that's reported. But this virus, and I haven't had to read the research as I have in the past, but it appears that as it spreads, that it becomes less viral, so it's weakening as a virus. So as a result, we have a lot more asymptomatic individuals. And so it seems that I understand what Dr. Holt is saying, that he make predictions. It seems that we should have some type of research or historical that would show us how it spreads exponentially. Young people that have it and may not know that they have it, how quickly it's going. I fear that by the time it becomes recognizable, it's going to be too late. I don't know if Dr. Holt could expound upon that, or just to give us some type of guidance in that. It just feels like we do what we can to get individuals to those precautionary steps, but it seems out in the community that we're over this, and that by the time we realize that there's a problem, we're getting overwhelmed. So just, I guess, an observation. Thank you. That's it.
Thank you. Mr. Merrill.
Kevin, if you could put up your slide again, your slides, slide number 7.
Sure, let me find it, sir.
Okay. So there's, Dr. Holt said there isn't one particular measure, but I think there are 3 that, if you look at them together and you look for convergence, if what the group is looking for is some yardstick, because hospitalizations is a good measure, except it's too late. Once the hospitals start being overrun, that's an indication of something that has happened before. So that's an important metric, but it has to be married with something that's more predictive. The third, and as soon as we get it up here, I'll show it to you. Okay, so 7, no, it's the rate. The rate chart, there you go. So why this is important is because the absolute raw number of people who are positive is not as important as what is the rate of positivity, because the rate relates to something. It relates to the number of people who are being tested. This is the chart that shows the change in the rate. The thing that I had Kevin add to this is the trend line, which is the dotted red line that's running horizontally from left to right. So that adds a predictive element to this, and the trend line looks at history, it looks at the current state, and it makes a prediction, and then it tells you how accurate the prediction is. How good is that trend line fitting the historical data? So that red line a few days ago, was tilted more in a downward fashion from left to right. Now it's showing that red trend line is starting to tip upwards. So that gives you a sense of, it tends to remove a lot of the sort of discrete stuff that is meaningful at a point in time, but it begins to blend it out and be able to say, well, here's where we think this is going. This can become a tool by which the group begins to make judgments in connection with hospitalization capacity, and the third, which is the one that is starting to show up, and that's younger people being positive, because they are the ones that are more mobile. They are the ones that are, I'm going to generalize because I don't have the data, but probably less likely to take seriously all the precautions. Because we all know, as Les Miller said when we were young, how we feel about being vigorous and above it all. But if they're the ones, if that's where it's growing the most, and they're the most mobile, it's pretty reasonable to draw a conclusion that they're going to potentially be the ones infecting more people in the community who are more vulnerable. So, I know that everyone, including me, would like to have a number. Give me a number, post it up on the bulletin board, and everyone knows what to hit. Life isn't that simple when it comes to this, and that's what Dr. Holt is trying to convey. But this can become a powerful tool as you see that trend line begin to go up and down, and as it starts to make over time, in a short period of time, even over a week, if that trend line begins to now breach the horizontal and begins to tilt upward, and you look at then hospitalizations, that can be a leading indicator for this group. Now, having said that, the hard part is, what do you do once you start seeing that? And the what you do part is almost harder than deciding on what's the indicator, because the consequence of dialing back to more restrictive behaviors means a lot of other very serious considerations on our economy, mental health. And so, that has to be part of the consideration. And I would say, I'm not speaking for Dr. Holt, but for this group to make that kind of hard decision about dialing back capacity and businesses and everything else, that red trend line has got to be pointing upwards consistently over a period of time. It can't just be pointing up for one day. It might take 2 weeks of data showing that trend line continually pointing up, where then this group would have to take seriously looking at dialing back. I hope that helps. Dr. Holt, would you agree, disagree? You're the public health guy. I only practice it on TV, but I've learned an awful lot from you, and I've learned an awful lot from spending hours and hours and hours on the phone with medical directors of our hospitals, with ACA, and so I'm trying to translate this into what may be helpful and meaningful, not just to the EPG, but to the community. And I will stop there.
This is Dr. Holt. And Mike, I concur with you completely. If you really want to look at the one indicator that is the best forecast, I think you're spot on. If that trend line does start shifting upwards, and assuming we are still testing, the caveat would be if we're doing a lot fewer tests, but I don't think that's going to be the case. And that's why testing has to continue. But if that testing denominator of those numbers remain in 1,500, or as Dean Lockwood has said, we can approach 2,000, that trend line is the best way to know the disease burden, if you will, or the cumulative coming, and how to either write it. But no matter what, we do need to try to keep reducing the transmission, and I think that's the message. And I'm hoping, and I still have already said, I believe in our community that we will get that response. So I'll stop there.
Commissioner Overman, you recognize.
Thank you. I do have a quick question for Dr. Holt. Given that hospitalizations is one of our numbers, obviously, and our rolling 14 average is one of our numbers, is there an observation or information that we could utilize that would indicate a trend at age groups? Because what we've heard today is we're concerned about the younger people actually numbers, quadrupling, and that's concerning. But what percentage at that age range end up being hospitalized? Because if they don't end up in the hospital and they recover in, 20 days versus the age 55 range that ends up in the hospital and spends 20 days or more actually in the hospital, we may not see hospitalization numbers correlate with an increase in testing positives. So I'm curious, what percentage at different age ranges actually require hospitalization, and what's that timeline on average of the hospitalization?
Yes, it's a great question. And, actually the CDC did early in their experience stratified the risk of hospitalization by age. And the interesting number was that if you look at the total number of hospitalizations, it's mostly associated with your 25 to 50, say, but that's as far as raw numbers, that's where the majority of the people who are infected, and about 20% of people who are infected in that age require hospitalization. But if you look at the extremes, you find very different numbers. You find, maybe 1 to 2% in the 5 or under 14 type of age group require hospitalization. If you look at the 75 plus, it is north of 30%. And I think just as a mention that, our elderly are paying a big price because they are the most vulnerable and they know it. And so they're the ones that are most likely locked into their areas, or they're separating themselves. And I personally see that when I talk to the long-term care. That's an extreme. But remember, this part of our community, while we see this virus spreading in our community, those residents have to stay in their room. And if they go out, they have to wear a mask. And so they're separated from their families. And I think the governor has committed to changing that. And I think if you want to make that happen, we do have to reduce community spread. And again, I'll stop there. I hope I answered your question.
Mayor Ross, you recognize.
Thank you, Commissioner. I don't want to beat the horse to death, but there's a couple numbers in here that I'll make sure don't get lost. And I also want to give kudos to Dr. Holt, because over the past couple of months, I've listened very carefully to him every week. And what's occurring now, at least in my mind, he was spot on in preparing us for this. What is, as that bell curve moves to the left in the younger population, are the ones who are making up more of the new cases now. I mean, he predicted that as the reopening of people are interacting, going back to work, they're congregating more. This is kind of to be expected in a way. So the good number is that the number of deaths is not going up at the same rate that the number of new cases is. And I want to make sure that number doesn't get lost in the mix. And Dr. Holt has told us all along that the best predictor from this disease is age. And he is, so far, he's been proven absolutely right. And as that number moves to the left, and it's the younger people who are, it's certainly not good. And I along with the other 7 members here, I'm alarmed to see that. But it's not all doom and gloom, and it shouldn't have been all unexpected either, because Dr. Holt's been saying all along that this could have happened, and sure enough, it is. And so I ask every week, Dr. Holt, to the point he's probably getting tired of me asking, but I ask about the contact tracing and what patterns can we find? Because I think us would agree, if we could isolate and say, okay, people are getting this at restaurants or bars or wherever, barbershops, fill in the blank, we would, I think all of us would agree then that would tighten up on whatever it is. In fact, he's telling us that the majority of cases are people that know where they got it, and it's from a family member or somebody that they've been in contact with, and it's somebody that they probably wouldn't have been wearing a mask around anyway, which may be how they got it. So I guess we're all struggling with the same thing. If we had the magic bullet, like Mr. Merrill said, the what to do is harder than the trigger of when to do it. The what to do is the real problem. And I wish,
that's right,
at least where I'm sitting right now, I wish that I could come up with a legislative answer of a law that we could, an order that we could pass that would stop this, but I don't know what that would be. You know, we're at the point now where people are getting this primarily from family members and people that they know that they're in close proximity to anyway. So I say all that just to say that some of this should have been affected by us, and it's not all doom and gloom. And I do, you know, the death rate is a huge factor for me because it's younger people getting it and younger people are surviving it. Not that it's good that they get sick, but it's not the deadly disease for the younger population. Thank you, Mr. Chair.
Okay, I don't see any hands. We're already into the EPG discussions. I want to put something out here to see how everyone feels. I don't want to make a motion and then it gets killed. With the discussion we've had today, in regards of whether they're getting the disease from people within their own households or people they associate with, whatever they're doing, I feel that we need to come back twice a week now instead of once a week, so we can get these updates on a more fluid and thorough basis from Dr. Holt and Mr. Wagner and Mr. Dudley as to where we are as testing. So I'm going to put it out there to see how you feel about coming back to start meeting now next week on Mondays and Thursdays instead of just Thursdays. So if anyone has any strong objection to it, let me see your hand. So we can discuss.
No, I don't.
Anyone has a strong objection? So do I need to make a motion to do that, or are we going to do it by unanimous consent?
Commissioner, this is
Unanimous consent.
Commissioner, this is Andy Ross. If it would make it easier for you, I'll make that motion to that effect.
Okay, let's get.
And I'll second.
We have a motion by Mayor Ross, second by Commissioner Merman to start our meeting, started back on Mondays and Thursdays, starting with this coming Monday. I see no hands to ask any questions at this time, so please call the roll.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Lott,
No.
Pastor,
Yes.
Ross,
Yes.
Cronister,
Yes.
Snively.
No.
Motion carries 6-2. Mayor Lott and Ms. Snively voted no.
Thank you very much. Mr. Snively, you had some information you wanted to share with us.
Yes, Chair. Thank you. As Commissioner Overman alluded to earlier, there was an announcement today from Governor DeSantis about reopening the schools and a return to normalcy for the 2020 to 2021 academic year. So I just wanted to touch on that briefly, just to make you aware of kind of where we are and where we stand as a school district. He specifically spoke about leveraging CARES funding to assist school districts to reopen safely, working with the CDC and local Department of Health officials, and also to use that CARES funding to address the achievement gap that may have occurred in the last 9 weeks when we were distance learning with our students, and maybe combat some summer loss, which tends to happen over summer break. And we do intend to return to outside activities like summer camps June 15th with guidelines, of course, and then VPK and after-school programs are going to launch on June 22nd. Based on the governor's response, we're going to be working on potential brick and mortar returns starting in July for students in the greatest need, who are the ones who are behind academically, unfortunately. So as a school district, we are prepared and developing a return plan that addresses a lot of the different delivery methods that are available to students with intentionally strategic cleaning to ensure safety for all of our students and faculty and stakeholders. So today's announcement confirms that students will be returning to school in August, and I will update you and answer any questions that I can with the information I have, and I'll continue just to bring information back to the EPG as needed, because it is such obviously a significant impact on our community with children returning to schools being such a large school district. So thank you for the opportunity to make mention of that information.
Okay, thank you. Is there any further discussion we need to have today? Any further discussion on any items? Mayor Castor, recognize.
The only thing I'd just like to make a final comment where Mayor Ross talked about the, no known preventative or solution, just to reiterate the research that shows if everyone wore a mask for 2 weeks, we could cut the virus by 80%. So just wanted to reiterate that. So that's the message we need to be carrying forth out to the public. Thank you, Chair.
Okay. Anyone else? Anyone else? Okay. We have our next meeting this coming Monday, June 15th at 1:30. With nothing else to discuss today, have a great weekend. We're adjourned.
Thank you.
Thank you.
Thank you. Thank you.